We are going to focus on Medicare. In fact, we have that annual enrollment on October 15th, and here to walk individuals through what they need to know, especially if they're worried about savings, money, expenses, healthcare, all those things, is Bob O'Connor. Bob, thanks for being here today. How are you?
I'm doing great. Thanks for having me, Christine. How are you doing today?
I'm doing well. What do seniors need to know when thinking about their Medicare plan? The deadlines are here, time is running out. So where do you recommend they even start?
Yeah, there's so many things to think about, Christine, and that's why we can maybe cut through some of the clutter and sort some of that things out. And so when people are looking through all the information they might be getting in the mailbox or the things they see on TV, they really want to think about some basic things about like, are their providers, their doctors, and their hospitals in the network? Taking a look at the plan's drug list. Is the drugs that the prescriptions that somebody's on, are they on the drug list? What will they cost? There's lots of changes that happen every year with that. And so it's important that people look at that. And then there's those extra non-clinical supplemental benefits that a lot of companies are adding too. And so, some of them, chances are going to be really valuable for a lot of different people. And so making sure that you're finding the right program for you. So it might be including dental versus a plan that includes healthy foods, or better yet, maybe one that includes both. And so lots of things to think about. And also another thing to think about is understanding about making sure that you're protected, right? And so a lot of people don't realize that original Medicare doesn't provide an out-of-pocket cap on what people might pay every single year. And so finding a plan that has a good maximum out-of-pocket to, protect the things that they do have.
And given the current state of the economy, how can individuals make sure that they're saving money with the plans they choose?
Right. So there are a lot of plans out there. As I mentioned, it's add a lot of different supplemental benefits. And so thinking about things that might be in your budget right now and help find a plan that covers some of those items. And so one of the things, for example, is fitness center. Maybe you have a gym in your monthly budget right now. Well, having a plan that has silver sneakers, like all of our plans do, will help take that out of your budget and cover that for you. A lot of our plans have coverage for eyewear. So maybe you're getting eyeglasses. It's getting pretty expensive to go to the optometrist, right? And so, having coverage that will help pay for some or even all of that eyewear. And food has obviously gone up a lot in the last year too. And so a lot of our programs, we've added a healthy foods card. And so, as we all know, oftentimes bad food is pretty cheap and good food is pretty expensive. And so, getting something that will help you buy a good meat, good protein, healthy produce, pantry staples, really takes the bite out of some of that inflation.
And any other benefits that we need to be aware of with this deadline coming up? And also, where can we get more information and find resources?
Great. Yeah. So a lot of the programs now include coverage for over-the-counter medications too. And so that can be pretty pricey if you add up all your vitamins and your supplements. And so finding a plan that will help cover some of that. And there are a lot of resources out there. Healthcare is different in every single community. And so there's a lot of good local agents that people can meet up with. And also a lot of good resources online. So there's Medicare.gov. And we also ask that people check us out at AetnaMedicare.com. Lots of good information in general and information about the plans. And I think the other thing to think about is the deadline is December 7th. And so people will, sometimes take a little too long, kind of bleed into Thanksgiving. And you don't want that hanging over your head during the holidays. And so we encourage people to get at it soon and, take the time to make a good decision.
So from October 15th to December 7th, they have time to make those decisions. Thank you so much, Bob O'Connor, for all of your great recommendations for saving money when choosing a Medicare plan. We're going to take a quick break and get back with more right after this.